Today, we're going to delve into the fascinating world of pharmacology, specifically focusing on a variety of medications and their classifications, indications, actions, side effects, and nursing considerations. Chapter 16, Antipyretics and Analgesics. Salicylates aspirin. 1. Classification, salicylates. 2. Medication, aspirin. 3. Indications, fever, anti-inflammation, analgesic, reduction of platelet aggregation. 4. Action, irreversible, non-selective inhibitor of COX-1 and 2, inhibits prostaglandin production. 5. Side effects, short-term use renal impairment, GI issues, bleeding ulcers, gastritis, dyspepsia. 5. Long-term use salicism, metabolic acidosis, respiratory alkalosis, dehydration, fluid and electrolyte imbalance, tinnitus. 6. Nursing considerations. Dose varies based on use. 6. Avoid alcohol ingestion with medication. 6. Be cautious of drug-drug interactions, contraindications. 6. Do not administer to children or adolescents due to the risk of Reyes syndrome. NSAID propionic acid derivative. 1. Medications, ibuprofen, Motrin, Advil, indomethacin, naproxen, celecoxib, ketorolac. 2. Indications, fever, analgesic, mild-moderate pain, anti-inflammation. 3. Action, non-selective inhibitor of COX-1 and 2, with more selectivity towards COX-1. Blocks prostaglandin synthesis and modulates T-cell production. 4. Side effects, GI issues, gastritis, dyspepsia, ulcers, bleeding. Selective COX-2 inhibitors linked to increased risk of thrombotic events, MI and stroke. 5. Nursing considerations. Many drug-drug interactions, contraindications, administer with food, avoid alcohol ingestion with medication, be cautious with renal impairment by monitoring kidney blood flow. Non-narcotic analgesic antipyretic. 1. Medication, acetaminophen, Tylenol. 2. Indications, fever, analgesic. 3. Action, decreases prostaglandin synthesis in the CNS, no anti-inflammatory effect peripherally. Antiprostaglandin activity in the hypothalamus reduces fever and causes peripheral vasodilation. 4. Side effects, liver toxicity in high, regular doses. 5. Nursing considerations. Inform patients about the risk of liver injury. Advise limited daily intake, especially with alcohol consumption. 5. Use caution in patients with liver disease. Chapter 18, Beta-lactam antibacterial agents. Beta-lactam antibacterials. 1. Prototype, ampicillin. 2. Drugs combining penicillin and beta-lactamase inhibitor. Amoxicillin plus clavulanic acid equals augmentin, ampicillin plus sulbactam equals unicin, ticarcillin plus clavulanic acid equals timentin, piperacillin plus tazobactam equals zosyn. 3. Indications, broad-spectrum use in skin, soft tissue, respiratory, GI, and GU infections. Prophylactic use in selected populations at risk for endocarditis. 4. Action, inhibit cell wall synthesis. 5. Side effects, allergy, GI issues, diarrhea, dyspepsia, renal impairment can cause penicillin toxicity. 6. Nursing considerations. Monitor for allergic reactions, advise patients to report signs of allergic responses, be cautious with bleeding disorders, and drugs interfering with hemostasis. 6. Watch for cross-sensitivity with cephalosporins and carbapenems. Cephalosporins. 1. Prototype, cefazolin, 5 generations available. 2. Indications, often used for surgical prophylaxis, broadening activity against gram-negative organisms and effectiveness against organisms producing beta-lactamases as generations progress. 3. Action, affects cell wall synthesis. 4. Side effects, risk of increased bleeding with warfarin, GI upset, diarrhea, pseudomembranous colitis, immune-mediated hemolytic anemia, potential for Clostridium difficile superinfection. 5. Nursing considerations, caution with warfarin use, monitor for bleeding, avoid alcohol with certain cephalosporins, and administer with food if gastric upset occurs. Chapter 19, Aminoglycosides and fluoroquinolones. Aminoglycosides. Medications, gentamicin, tobramycin, amikacin. 1. Indications: coverage of aerobic gram-negative bacteria, Pseudomonas, Klebsiella, Serratia. 2. Action: penetrate cell wall of susceptible bacteria and bind irreversibly to ribosomal subunits. 3. Side effects: ototoxicity, nephrotoxicity, adjust for renal impairment. 4. Nursing considerations: measure peak and trough levels, watch renal function, and monitor for signs of ototoxicity. 5. Fluoroquinolones. Medications: ciprofloxacin, Cipro, levofloxacin, ofloxacin. 1. Indications: active against aerobic organisms, most gram-negative and some gram-positive, e.g., respiratory, GI, GU infections. 2. Action: inhibit an enzyme, DNA gyrase, important in bacterial DNA replication. 3. Side effects: tendon rupture, tendinitis, photosensitivity, Candida superinfections, CNS effects. 4. Nursing considerations: avoid in patients with myasthenia gravis, caution with renal impairment, and in patients aged 60 and older, avoid concomitant use with aluminum, iron, calcium, or zinc supplements. 5. Chapter 20: Tetracycline, sulfonamides, and urinary antiseptics. Tetracycline hydrochloride. Medications: tetracycline, doxycycline, minocycline. 1. Indications: chlamydia, UTI, acne, periodontal disease, Rocky Mountain spotted fever. 2. Action: bacteriostatic, binds to 30S ribosomal subunit, broad spectrum. 3. Side effects: discoloration of developing teeth, GI distress, photosensitivity, candidiasis. 4. Nursing considerations: take most oral tetracyclines on an empty stomach with a full glass of water, avoid prolonged exposure to sunlight, allow at least 2 hours between ingestion and certain chelators, milk products, calcium supplements, iron supplements, magnesium-containing laxatives, and most antacids. 5. Sulfonamides. Medication: trimethoprim sulfamethoxazole, Bactrim. 1. Indications: broad spectrum, including many gram-negative and positive bacteria, UTI. 2. Action: blocks bacterial enzymes important for DNA, RNA, and protein synthesis. 3. Side effects: hypersensitivity reactions, heme-related issues, hemolytic anemia, blood dyscrasias, crystalluria, CNS effects. 4. Nursing considerations: maintain hydration, observe closely for rash with the first dose, avoid in patients with severe hypersensitivity to sulfonamides, exercise caution in renal impairment, advise patients to consume sufficient water, and monitor blood cell counts. 5. Chapter 21: Macrolides and miscellaneous anti-infective agents. Macrolides. Prototype: erythromycin, new macrolides, azithromycin, clarithromycin. 1. Indications: gram-positive and some gram-negative bacteria, respiratory, GI, skin, community-acquired pneumonia, H. pylori. 2. Action: inhibit 50S ribosomal subunit. 3. Side effects: GI tract irritation, drug interactions, corrosive to veins or GI tract in some forms. 4. Nursing considerations: administer erythromycin, clarithromycin, and azithromycin cautiously, as they inhibit cytochrome P450. 5. Azithromycin is a weaker inhibitor. 5. Dilute IV forms in large quantities of fluid, infuse slowly into a large vein. Vancomycin. 1. Indications: potentially toxic antibiotic used for serious gram-positive infections, MRSA, endocarditis, and bowel infections. 2. Action: affects cell wall synthesis. 3. Side effects: ototoxicity, dose-related nephrotoxicity, multiple drug interactions, irritating to veins. 4. Nursing considerations: monitor peak and trough levels, watch renal labs, infuse slowly to prevent red man syndrome. Metronidazole, Flagyl. 1. Indications: targets anaerobic organisms, including parasites and bacteria like C. diff. 2. Action: prodrug activated only in anaerobic cells. 3. Side effects: darkening of urine, CNS adverse effects, caution during pregnancy, avoid during lactation. 4. Nursing considerations: Check for drug interactions. Administer both orally and intravenously. Chapter 23, Antivirals. Acyclovir and valacyclovir. 1. Medications, acyclovir, valacyclovir. 2. Indications, active against all herpes viruses, simplex, zoster, cytomegalovirus. 3. Action, suppresses synthesis of viral DNA. 4. Side effects, nephrotoxicity. 5. Nursing considerations. Maintain hydration to dilute drug in renal tubules. Advise proper hygiene and condom use for herpes simplex genitalis patients. Adamantanes. 1. Medications, amantadine, oseltamivir, Tamiflu. 2. Indications, influenza, although no longer recommended for flu A by CDC. 3. Action, neuraminidase inhibitor. 4. Side effects, few, but nausea and vomiting. 5. Nursing considerations. Most effective when taken soon after flu symptoms appear. Monitor symptom duration and severity, and be cautious with drug-drug interactions. Ganciclovir. 1. Indications. Active against all herpes viruses. Reserved for CMV treatment in immunocompromised patients. 2. Action. Excreted unchanged in urine. 3. Side effects. Granulocytopenia, thrombocytopenia, teratogenicity. 4. Nursing considerations. Decrease dose for renal impairment. Monitor blood counts. Use birth control, and be cautious with drug-drug interactions. That concludes our overview of various medications and their pharmacological properties. Remember to consult with healthcare professionals for specific patient needs and concerns. Thank you for your attention.